Oh, one of the areas has been the health concern. We've had reports of people losing their eyes, people even dying, others getting serious health risks associated with drinking illicit alcohol, or what Kenyans call drinks imbo.
Yes.
So please just take us through the health risk associated with people, especially consumers, consuming illicit alcohol. Like you've just rightly mentioned, somebody is just buying something because it's so cheap and they can afford, but in actual sense, they actually even know, for example, they're taking illicit alcohol.
Yes.
What are these health-related risks that consumers are exposed to?
One, we've seen a proliferation, first, of illicit ethanol. Because you'd find there is excess tax charged on ethanol. So you'd find, first, there is a lot of smuggling. So molasses will be smuggled to, let's say, neighboring countries. Then somebody will smuggle ethanol, let's say from Uganda and Tanzania. At the border, disguise it as oranges coming from somewhere, but there's a lot of concealment. Now, where our concern is, most of this illicit ethanol that is smuggled through the borders will end up to places. In the past, we used to call them den, but now we are seeing also a lot of illicit being done in the palatial homes, residential areas.
Yes.
Now, the quality of how they're able to maintain, the quality of how they're able to produce, the quality of how they're able to package is not assured.
Yes.
So you'd find a situation whereby instead of it having the required 40% alcohol by volume, it could have 45, it could have 46. Now, there is even a more dangerous scenario whereby you'd find some of them don't bring ethanol, they bring methanol. And why is it? Because the person who is doing it, the counterfeiter, wants to make quick money. They want to source very cheaply. And now methanol is not fit for human consumption. So you'd find that even with methanol itself, if you take about 10 millimeter, you'll go blind.
Wow.
And as a country, we've had the sad days of kumi. That was something that was impacting our people. You always hear the joke of hata mkizima taa bado tutaendelea, only for somebody to realize that they have actually lost their eyesight.
Exactly.
And we've seen even recently, as late as last year, we found a scenario like in, I think it was in central Kenya, where sadly consumers consumed illicit and they're able to pass on. They passed. Some were going blind, and it's a health concern. And if you look deep down into that bar where they consumed, the reports we've seen as an industry is that there were two types. The bar owner had legitimate products also. So those who had money drank from that. These are the ones who didn't have money, unfortunately. They were able to take from the jerrycan. So you'd find it's one scenario whereby those who do not have, sadly, because they can't afford, they'll go to this other option.